Hello, this program aims to provide culturally appropriate, affordable and accessible adjuvant healthcare to Australian Indigenous women, AIWs, living in rural and remote communities with a breast cancer diagnosis. Australia has some of the highest breast cancer rates throughout the world, and despite the fact that we also account for probably some of the most superior health outcomes and survival rates when it comes to breast cancer, there still remains evidence that Indigenous Australian women, AIWs, experience poorer health outcomes. So statistics show that the most commonly diagnosed cancer in AIWs is breast cancer, and in 2014 statistics revealed that 25% of Indigenous women accounted for the total Australian breast cancer incident rates. And despite the fact that Australian Indigenous women are 30 to 50% less likely to develop breast cancer, their health outcomes are blatantly inferior to their non-Indigenous counterparts, and this has been associated with lower participation in breast screenings and, as a consequence, later detection in their breast cancer diagnosis. So the target population for this program is AIWs living in rural and remote communities with a breast cancer diagnosis. The rationale is that we would provide a minimum of 2 and a maximum of 4 weekly acupuncture treatments every week in a community acupuncture clinic over the course of 6 months when referred to the program by a GP. These treatments would be delivered in an existing community centre or appropriate building with the facilities required for acupuncture healthcare. And this is with the hopes of providing the AIWs with a breast cancer diagnosis a place to connect and to yarn about their experience with breast cancer, a place to access educational resources about primary care, breast screening purposes, and also adjuvant healthcare. The implementation would be that the program would partner up with local or resident acupuncturists close to or within that Indigenous community, and it would be provided within rural and remote Indigenous communities across the Northern Territory where appropriate facilities are available. And if there weren't any resident acupuncturists, then the program would be looking to endorse a mobile acupuncturist to service that region over a certain amount of time. The community centres would be determined by their central locality and ease of access, and a healthcare car would be provided for a collective pick up and drop off to the community program because public transport is not an option in these areas. The program is to operate as a government subsidised program with participants satisfying the criteria of a breast cancer diagnosis and a GP referral. The treatments would take place on a community acupuncture setting. So this actually allows the acupuncturist to treat as many as up to 5 or 6 patients within the same hour. And in the instance where there was a greater number of patients to acupuncturist ratio, then we would be looking to endorse another acupuncturist to help with the program within that area. The program is also looking to partner with Breast Screen Australia to provide mammogram screenings for members of that community on every 6 months, on the basis of every 6 month scale. And this would be to encourage breast cancer screening, provide an opportunity for education of breast cancer screening benefits, early detection, primary healthcare services, and how adjuvant healthcare works with primary healthcare to treat not to treat, but to manage their symptoms. So the program would be limited to 5 years, and this would be time enough to establish the success of the program and to evaluate any opportunities for improvement or opportunities to expand. So the program is to be reviewed and updated and adapted to other rural and Indigenous communities throughout Australia if it was to be deemed successful. The evaluation process would be an initial evaluation with qualitative and quantitative data obtained from the patient by the acupuncturist. This would include the details of the community, the region, the stage of diagnosis, the chief symptoms, primary health care received, and medication taken. It would also require the patient to complete an SF-36 questionnaire and a severity scale concerning each of the symptoms reported. Then there would be a process evaluation completed at the end of each treatment by the acupuncturist and by the patient. Again, specifically referring this time to each treatment reported and quality of life. There would be also an impact evaluation. So at the end of the first 6 months, there would be an assessment of all the qualitative and quantitative data collected, and the patient would be asked to complete another SF36 questionnaire just to see what has improved for them after that time of treatment. And overall, on every 6 months, there would be the outcome evaluation. So the impact evaluation would be repeated every 6 months and reported to the GP to assess potential primary care revision. Thank you.